So as you are seated here, we have vacancies for you. You can still bring your children here and they will benefit from learning. Now, today in our school history marks a very important day that the Action Foundation found it fit to make us host this conference. One, a caregiver conference that will give us a forum where we can have a voice and share our experiences. Two, today likewise, in the history of this school, we are launching a therapy center.
1, 2, 3, and go!
It's thanks to God because He has made it possible that I may be part of this during my time as the principal of this school. I joined this school and we have always dreamt of that opportunity where we'll be able to provide therapy within the learning setting. That means this will reduce a burden to our parents. It will also allow our learners have adequate learning time because they will not have to leave school to go for therapy. So, to Action Foundation, hongera sana.
So today we are here and we hope to achieve a number of objectives as we are seated here today and tomorrow. So one of the objectives for this conference is to emphasize the critical role of nurturing care in providing quality life for children with disabilities and their caregivers. The second objective is to promote representation and voice, ensuring caregivers and children are included in policy and practice discussions. The third one is to empower caregivers with tools, resources, and support they need for them to be empowered for self-advocacy. And finally, we want to highlight the importance of caregiving, grassroots advocacy in driving system change.
Having the CARE conference has been a dream for the Action Foundation for so many years. Since we started expanding our programs to other informal settlements in Nairobi, we have always thought it's important to bring the caregivers together, to share knowledge, for them to network, for us to impart them skills on self-advocacy, and then also to invite different speakers that can upskill them and expand their knowledge on how to care for their children. So it's really been a dream come true, and we believe that we are just getting started. The fire has been lit, and going forward, we're going to have more structured ways of supporting the caregivers to advocate for themselves and for their children in communities, but also at sub-national and national level. Well, it's important to amplify the voice of caregivers because first, a child with a disability's well-being is 100% dependent on the caregiver's well-being. And a supported caregiver equals a supported child. As you've seen today, caregivers want to be seen, they want to be heard, and they want to participate. So it's important to strengthen that. It's important to build their agency, to amplify their voices, because we know from our work that translates into improved outcomes for their children.
As a caregiver of a child with disability, umetuambia you have 2 children with autism. How do you practice responsive caregiving? What approaches have worked well for you?
Asante sana. As a caregiver, interactive play is one of it. Nimekuja kujifunza ya kwamba hawa watoto wetu wanaweza cheza kama wengine, lakini inaanza na mimi kama mzazi kwenda to their level. Ninacheza na wao. Tuseme for instance, one of my child likes dancing. So I have learned one way to get through to him is to dance with him. I may not necessarily dance in his space, but I can dance just next to him, and then I'm able to get him, to then probably do what I want him to do, but I first start with anzia na penye mtoto wako, and it's been working.
Our children deserves best out of us. One of them is the health services we are offering, and our children deserves. So a child with disability deserves to get full immunization as any other child. That is, gets the vitamin A supplementation, gets dewormed as appropriate as the age progresses. This will help us achieve the milestones. And once we achieve the milestones, then we are improving the quality of life for our children. So you have what it takes to support this human being or to support the gift God gave you. Thank you.
We want to participate. And so, do you remember the 4 principles that Maria has echoed? Number 1, we want to be. We want to be. We want to be. We want to be. I want to be seen. We want to be. And number 3, we want to be. And number 4, we want to. And thank you so much.
So for today's event, I was a panelist speaker on the mental health for caregivers, and I really think that the Action Foundation really took a good step in making sure that we are having mental health conversation for caregivers, because most of the time we find that when you're talking about mental health, we tend to forget the caregivers, and they go through a lot of mental health issues and nobody is taking care of them. And in order for them to take good care of the people they're responsible for, they really need to do what they really need to take care of themselves. So kudos to the team for making sure that you're having a panel around mental health, especially for caregivers. And I'm glad that there was a consensus need that this conversation needs to continue for mental health for caregivers. And yeah, looking forward to hearing more and learning more also from the community.
Today's conference has been quite enlightening. It is a baby long overdue to be born. We have always looked at the persons with disability within our community and forgotten the most important person, who is the caregiver. Caregivers are people who give 100% of their time to these people with disabilities. And a lot of times we forget that they too have their needs, they too have their challenges, not just challenges with the persons that they're caring for, but even their own personal challenges. And they don't have an option of taking a day off like the rest of us, so you can take time off or go for leave or something. They constantly are caring for these people with disability, and especially for children. And it takes a toll on them. It takes quite a bit of a drain. And even when we look at policies and other interventions that are put into place, they are never factored or thought about. And it's really saddening, but this is an awakening and a really amazing opportunity. The conference today has been really good, just to hear their voices, to hear the challenges, the barriers that they face, and some of the interventions that they would like to see put in place for them.
Asanteni sana, and we are going to now call upon the speakers of the first plenary session.
Caregiver Awareness, Resource and Empowerment Conference. I wish we had this 15 years ago, because I think looking at the crowd right now, it's amazing. Come as caregivers pamoja, tushirikiane, tujuane, tujitengeneze, tujiinue as parents of children living with disabilities. Personally, I'm an advocate for people living with rare diseases. Nikianza, my kids didn't have anywhere to go. No one knew what a rare disease was. Na ilikuwa kazi kuambia daktari, mtoto anafaa kuwa na hii, mchunguze hii. I think hii inafaa kukaguliwa kila kitu. But with time, we found a community that grew and grew. For now, we are like around 200 people in the group for rare diseases, and that ilianza mtu moja akisema ni lazima tusikike.
We have been undertaking some reviews of the previous documents that we have developed as a ministry and as a government to make services available, rehabilitation services available, assistive technology products available to persons with disabilities. And of course, we don't isolate children with disabilities. We want to be friendly as health workers. We want to be friendly to the persons with disabilities so that they feel encouraged, they feel supported, and they feel part of this community of this country. Training and scholarships. That will also be a package just to make sure the persons with disability in this country will access services through awareness creation. Short courses we have also created, and among those short courses we are encouraging therapeutic play for children so that they start interacting and being integrated with society at the earliest time possible. We know there are challenges. These challenges must only be overcome when we understand the space and when we prioritize what kind of intervention make. Of course, some of the challenges are resources, both human and funding, because as we said yesterday, the government will not have enough funding and will not allocate enough resources unless we also voice our needs as a population and cater for ourselves.
The session you're having today is about representation and voice, ensuring caregivers and their children are included in policy and practice discussions.
The issues we are talking about are human rights issues. When we say we must be seen or heard or counted or participate, what we are asking is actually what is a human right. Every right of a child is a human right. So if you deny a child their right, you have denied all of us our human right.
Mi naona challenge kubwa sana ni opportunity. Caregivers wetu ambao nime interact nao sana, najua wanataka kutetea haki ya watoto wao. So opportunity ni kitu ambayo ninaona inakosa, lakini on the other side najua wakati mwingine kama mtu akupati kiti kwa meza, si unaweza vuruta kiti ujiwekele hapo ukatae kusonga. So itabidi katika hiyo hali ya opportunity sisi nayo pia tuseme tuko hapa, tutaketi na tusongi hadi mtusikie.
Unapata mzazi hana pesa ya therapy. Therapy centers ziko chache na zinalipishwa. Na unapata huyo mzazi kwa sababu ya hali ya mtoto wake mwenye ako na changamoto hata hawezi kuwa na income ya kulipa kwa hiyo therapy. So inakuwa bei ghali. So mtoto anaweza enda, zingine ana miss. Na the more ana miss, anazidi kurudi nyuma kiafya. Pia tunapata uptake ya NHIF kwa watoto, wazazi wenye wako na watoto walemavu. Unapata pia hiyo malipo ya kila mwezi, huyo mzazi hana uwezo. Kwa hivyo tungesi policy makers, they can waive or reduce hiyo payment ya NHIF so that wazazi wetu hapa waweze kuchukulia watoto wao NHIF. Na hata kwa hiyo NHIF policy include even therapy zikuwe hapo ndani ili au wazazi wako na comfort.
And I think ama nafikiria limitations zetu sengine tunaogopa. Tuongee tuseme nini? All we are not recognized. Hakuna mtu anataka kujua tuko ama tuko. All we are not informed. But tutatoa hizo limitation namna gani? Kuna hizi public participation. Do we attend?
We are afraid of looking for the information. Information is out there. And as the head of rehabilitation services said, the policies are there. They are in place. But one thing that we need to do is to make those in duty offices, the duty bearers, accountable.
Ukiwa na mtoto na ako shule, unapeleka school fees pro forma, you apply for bursary na anapewa. Kwa hivyo kitu ya kwanza, let us register our children with National Council.
Ndio posa upate mahali mtoto atasuit. It's a big challenge. Na ile shule ambao unaambiwa mtoto anaweza pata usaidizi, unaambiwa ulipe. Na it's so sad to say, wazazi wengi hapa ambao wana watoto ambao wana ulemavu, our pockets are not good.
So you guys are talking about us going for the forums so that we can be heard. Hizi forum tukienda ziko na connection. Ukienda utaulizwa nani amekupigia simu, hautakubaliwa kuingia. So what can we do about that?
The caregivers were left out during the affirmative action. Actually, it was supposed to be reading caregiver, women, youth, and PWDs. Kwa hivyo hiyo mfanye recommendation na irekebishwe haraka iwezekanavyo.
Mtoto wangu ako na shida ya kuconverse. Sasa demonu unatumia hizo dawa zenye anakunywa. Inafika mahali nataka kwenda kununua, unapata dawa hakuna. Na huyo mtoto asipokunywa hizo dawa hawezi lala. Anakesha kulia, anatafuna meno. Ukienda kununua unapata dawa hakuna. Yule anakuuzia dawa anakupandishia juu anajua dawa zipatikani. Ilikuwa nafikiria kama mnaweza tusaidia.
My name is Judith. Nasimama hapa kwa capacity ya ECD Network for Kenya, the National Coordinator ECD Network. I'm going back with so much more from from the 2 days workshop that we have had. I'm amazed by everything that the panelists have already spoke here and all the challenges that they have addressed and everything that they have put forward. And I'm cognizant that I will go back, I myself as a communication person and also a communication of the network, on finding ways to reimagine how best we can communicate whatever has been learned here to the public, and for all caregivers get to learn what exactly you have showcased. The ECD network works in different programs. There is one called Msingi Bora that we work with all caregivers so that we can give them responsive curriculum and also synergy for inclusivity in the curriculum. Thank you to Action Foundation and to all the stakeholders present, and I'm grateful for our parents, our civil society, and also the government. I'm very cognizant that from all the challenges that have been addressed here, they're not going to end here. We are going to work with them. We are going to work with the caregivers to make sure that all of them are addressed. From ECD Network for Kenya, the National Coordinator, we say thank you, and we thank the Action Foundation for this wonderful time. Thank you very much.
Nataka kushukuru Maria, Action Foundation, the whole team kwa kunialika hapa kuja kuongelesha. I hope nimeongea vitu za maana na naomba tutakutana siku nyingine, si ndio? Mbarikiwe.
First of all, I want to thank everyone for showing up and to thank Action Foundation for their partnership and the close relationship they've had with KISE. And I would like to extend an invitation to each and every one of you to come to KISE. This year on the 5th and 6th of September, we are hosting a national expo on assistive devices, technologies, and specialized learning materials.
I'd like to thank the Action Foundation for this initiative, the Ministry of Health through the Head of Rehabilitation, Mr. Kisianga, to all donors, stakeholders, caregivers, CHPs, our DJ, and all participants who are here. This has been a really enlightening activity, and going forward, we hope that we are going to hear more of your voices. We are going to be able to hold our hands together and walk this walk together, for no one can walk it alone. I'd like to say, as Nairobi County, we have your back. We have been very involved in activities for persons with disability, and we hope that you will continue to hold us accountable in the areas where we need to be held accountable. And we have an open door policy. We are there, you can reach us at any time, and we appreciate all of you.
So we would like to acknowledge everybody who has managed to make it today.
We are very grateful for your participation and for all of the exchanges here. We have been very impressed. Even as rapporteurs, we have been capturing everything that has been said, and we have really enjoyed today's session. We have enjoyed the opinions of all the caregivers here, and we have enjoyed the opinions of all the participants who have come up here and spoken to us about all the solutions and strategies that we can use to go forward to be able to empower our caregivers and to also benefit the children with disabilities that they look after. The Dagoretti Declaration from the Caregivers Conference. We, the participants of the inaugural CARE, which stands for Caregiver Awareness, Resource and Empowerment Conference, held on 1st and 2nd July 2024 in Dagoretti, Kenya, including government officials, caregivers, civil society, and multilateral organization representatives, reaffirm our commitment to empower caregivers to effectively fulfill their roles while prioritizing their own well-being and enhancing the quality of life for children with disabilities. We raise our voices in unison in a clarion call, Hatutachoka, and pledge that we want to be heard, we want to be seen, we want to be counted, and we want to participate. Acknowledging that equality is essential, we, the caregivers here, recommend that 1. There be a national registration and tracking of all children with disabilities for purposes of planning and follow-up. 2. There is a need to integrate registration and assessment data to support proper budget allocation for children with disabilities. 3. We use the media in public conversations to go beyond the conference, and we acknowledge that the national media has come for this conference. Thank you. 4. Caregivers, be encouraged to join public participation forums to give their input in mapping out challenges and developing strategies towards formation of policies. 5. There is need for awareness and sensitization of availability of and access to assistive technology services. National and county governments consider having budget allocation for assistive devices for persons with disabilities. 6. Networking and collaboration among key partners to boost education level and inclusivity of children with special needs in schools. Caregivers in schools should be employed by the government. 7. Improve partnerships to bridge the funding gaps and support access to services. 8. Scale up human resource capacity in specialized areas to meet the demands for healthcare rehabilitation services and assistive technology. 9. Provide training for caregivers in the line of the unmet needs of children with various disabilities in the community. 10. Government to implement policies and guidelines on disabilities to consider including caregivers for supportive assistance. And finally, 11, CHPs, community health practitioners, providers, are empowered by service providers and partners to support in sharing information to caregivers about forums and outreaches that they can participate in. That is the end of our declaration.